Neuroleptic induced Parkinsonism is the topic for this video. Now, neuroleptics are also known as antipsychotics, and these are basically medications that are used to treat psychiatric disorders such as schizophrenia. And what happens is you have very important side effect, and that side effect is Parkinsonism, side effect of these medications. So that's what we're going to talk about in this video. So first, just a little bit about neuroleptics. Neuroleptics are a very widely used class of psychiatric medications, also known as antipsychotics, and they basically are used to treat schizophrenia. They're also used to treat other psychiatric disorders, psychotic disorders, psychosis, and other behavioral disturbances. And the way they work is they actually block dopamine. They're dopamine antagonists. That's the mechanism of action, dopamine antagonists. So they actually block dopamine, so you can kind of think of it as they decrease the dopamine levels in the brain, and that's their mechanism of action. And there's two categories. There's typical antipsychotics, and then there's atypical antipsychotics. So antipsychotics being the broad category, and I think it's important to mention the atypicals, the names clozapine and quetiapine, quetiapine, however you pronounce it. And the typicals are very common: haloperidol, and a long list of others. Now, the reason I wanted to mention the names is because on licensing exams they'll test you on this, and the reason they break this up into typical and atypical is because the atypical ones cause less side effects. They have a lower incidence of Parkinsonism as a side effect. So that's a very commonly tested component of antipsychotic medications. So when you give these neuroleptics, they can cause Parkinsonism as a side effect, because Parkinsonism essentially is a neurologic disorder in which you have decreased dopamine in the brain. So essentially you will have a scenario where a person is placed on these medications, and then maybe a month later the person will develop symptoms like slow speech or gait. Shuffling gait actually is the way they start to walk. They can also have masked faces. What that means really is just an expressionless face. Other side effects or terms that you commonly see on licensing exam is akinesia. Also, other drug-induced movement disorders can happen, like tardive dyskinesia. Which is the excessive movement of lips, tongues, and jaw. And when this happens, it's a very, very important clue that this patient is starting to develop symptoms of Parkinsonism directly because of the use of antipsychotic medications. So what I wanted to do is show two clinical vignettes that will illustrate this very clearly. 36-year-old man is admitted to the hospital for acute management of his schizophrenia. He's a homeless man that you often see hanging out around the neighborhood. He has had multiple hospitalizations over the past 5 years, and they usually occur when he stops taking his medications. He usually believes that his dead cousin speaks directly to him through fire hydrants and that he tells him that he does not need to take any medications. Unfortunately, she is the only person that he listens to. You are called to see him because you have treated him many times. When you go to the floor, a nurse tells you that you should be careful when you enter the room because the orders for a medication have not been written yet. You hear howling as you are talking to the nurse, and when you get to his room, you see that he is kneeling at the window, howling at the moon. He becomes very angry and violent, and when you try to enter his room, you go back to the nurse station and tell him to give him an injection of haloperidol and diazepam. In addition, at this time, you should. Okay. Well, this is a acute psychiatric issue, acute psychiatric emergency. And in these kinds of situations, you give a neuroleptic drug to calm the patient down. And in the vignette, they've said they've given haloperidol. Now, this haloperidol can cause a Parkinsonian-like symptoms. It can cause rigidity and akinesia. And it happens especially with high potency antipsychotics like haloperidol. So you don't want that to happen. So because you don't want that to happen, you want to give an anticholinergic agent. So you want to give an anticholinergic drug to prevent the Parkinsonian-like symptoms. And the one that you would give is known as benztropine. So this is a perfect example of drug-induced Parkinsonism, and you're trying to prevent it, and you prevent it by giving an anticholinergic drug known as benztropine. And the final one, a 67-year-old widowed woman you have treated for several years for depression and hypertension is brought to the office by her daughter. Your patient offers little information, but her daughter reports a 3-week change in her mother. The family has noticed poor appetite, social withdrawal, and problems sleeping and concentrating. She has been crying more as the anniversary of her husband's death approaches. The daughter tells you her mother has commented on people driving by all night and watching her. She has taken hydrochlorothiazide and fluvoxamine for several years and has had no recent changes in doses. No allergies, temperature is normal, blood pressure is normal, pulse and respiration are also normal. She is depressed appearing and has almost no spontaneous speech or motor movement. Physical exam is normal except for a slight tremor, and with much encouragement she scores 30 out of 30 on mental status exam. She tells you someone has been tampering with her food and she is afraid to eat it. You diagnose a recurrence of depression, severe with psychotic features, and start her on an antipsychotic medication. You inform her that a common side effect of antipsychotic medications is. Well, that's the whole point of this video, is that when you give an antipsychotic medication, you block dopamine, and when dopamine, because antipsychotic medications are dopamine antagonists, and when you decrease the dopamine in the brain, it can lead to Parkinson. And women and older patients are at higher risk, and it may occur in up to 50% of patients on long-term antipsychotic therapy. It usually develops within the first few weeks of therapy, and therefore the answer to this question is E.